If you want to learn everything you need to know as a nurse about anion gap, then this is the video for you. Anion gap is an important lab result mainly used to determine the cause of and monitor the treatment of metabolic acidosis. It involves a mathematical equation based on the electrolyte panel to measure the difference or gap between positively charged ions, called cations, and negatively charged ions, called anions, in the blood. The main cations in the blood that are used to measure anion gap include sodium and sometimes potassium. Potassium concentrations in the blood are relatively insignificant, usually making little difference. Therefore, most, but not all, labs exclude potassium from their measurements. And the main anions in the blood that are used to measure anion gap include bicarb and chloride. Normal anion gap varies from lab to lab due to differences in equipment, techniques, and inclusion or exclusion of potassium. With this in mind, anion gap usually sits around 4 to 12 milliequivalents per liter, but it is best to refer to your specific lab for their normal range. In reality, anion gap does not exist as the human body is electrically neutral. This means there is an equal amount of cations for anions, resulting in the difference between the two to be zero. Measurement of anion gap only uses the most abundant cations and anions in the blood, leaving out albumin, phosphorus, and various proteins. These unmeasured cations and anions are the reason for anion gap. Anion gap is a useful lab result to determine the cause of metabolic acidosis. If you want to learn more about metabolic acidosis, then click the link on screen or in the description down below. If anion gap is greater than 12 milliequivalents per liter or greater than normal, it indicates metabolic acidosis is due to increased acid secretion or decreased reabsorption of acids. Anion gap is increased because hydrogen binds to bicarb, decreasing bicarb concentrations in the blood. However, if anion gap is normal, it indicates metabolic acidosis is due to bicarb loss. Anion gap is normal because an equal amount of chloride is reabsorbed as bicarb is lost. And finally, if anion gap is less than 4 milliequivalents per liter or less than normal, it is usually due to laboratory error, as this result is extremely rare. This wraps up everything you need to know as a nurse about anion gap. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!